Hi, Sophia. Good morning.
Morning.
How are you feeling today? How is it at your end?
I'm good. Yeah, I work from home today. Just a nice one. So
Yeah.
yeah, how about you?
Yeah, I'm also working from home,
Yeah.
finishing up my history training activities and looking
Mm.
into some of the recordings from the exams and all those stuff.
Yeah, I'm doing the same basically.
Oh, okay. Nice. So, this is our first episode, and I'm not sure how it's going to go, but let's see
Yeah.
what we'll get from there. Okay, so can you give us a bit of an introduction about yourself?
Yeah. So I'm Sophia. I'm originally from Cardiff. I am 25 and my background, so my educational background was I did my undergrad in biomedical science in 2017, so would have graduated in COVID. And then I went on to do cancer biology and therapy at Cardiff University. That was very enjoyable. And then in terms of my work experience, during COVID, I actually worked as a healthcare assistant and also in a coffee shop. So I did those two jobs in parallel. Very different, but yeah, I definitely got skills from both of those, which I'm really thankful for. And then I eventually was able to get a job in the NHS as a clinical trial administrator. So within that role, it was basically just liaising with the pharmaceutical companies, filling in the database and things like that, and just in general, just
Well,
general admin stuff in the NHS. So yeah, really good. Then I applied. I applied for the STP. I say 3 times. I think in hindsight, the first attempt was a bit. I'm gonna try and not count it. I'd say, but yeah, then got lucky enough to third time get on.
that's really nice.
Yeah.
Did you have any form of research, particularly research on lab experience?
No, definitely not the NHS. So as part of my masters, we had like a 12-week like your dissertation bit. We did things like Western blot analysis, immunofluorescence. But yeah, it was very. Now I've been in an NHS lab. Obviously, lots can be applied to stuff. Yeah, but I didn't. The first time even, I'd been to like an open day in the NHS lab in biochemistry, and then that was it. And then I started the program, and obviously then it was just here's the NHS lab. So yeah, I hadn't really seen it before. But yeah.
So, how have you been finding getting used to being around an NHS lab or integrating into the lab? How have you been finding it?
It was definitely very overwhelmed to begin with. I don't know whether did you have lab experience before?
Yeah,
You had a
not uh not purely hospital lab experience. It's
mm,
just more of my master's experience, and just like
yeah,
you
so
said, I also felt overwhelmed getting introduced to the NHS. Like, I made a post
yeah,
this morning about the shock of the things I had to learn, the
yeah,
abbreviations and all that. So yeah, it was overwhelming for me.
yeah. I mean, everyone is so supportive and so lovely. So there is absolutely, there is no need to be stressed or anything like that, obviously. But yeah, when I first went in, I definitely, especially when I went to, because our genomics lab is in Southampton's a bit smaller, so Salisbury's quite big. But then, especially when you go to things like histopathology, the volume in which they get, I was just like, wow, it was such an amazing experience to see. But definitely, yeah, I was just so nervous to do stuff. I just didn't want to touch anything, didn't want to do anything wrong. But yeah, everyone was lovely. Yeah, it's
Yeah,
definitely really enjoyable.
I completely understand that feeling. Okay, so what trust are you training at? Can you
So I'm in Southampton, which is split across. So it's half and half Southampton and Salisbury.
okay, cool. So can you tell us about your STP application experience and interview experience as well?
Yeah. So with the application process, I'd say if I was looking at it in terms of when I was thinking about like what I kind of did differently at this point from the third application, from the first application, I definitely say even though I know it's changed a bit. I don't know how long it is at this point, but obviously it's quite at our time. I think it was 1,000 words, wasn't it? Which is pretty
Yeah.
short to get like most of the stuff in. So I definitely spent a long time on my application, like, rewriting it, trying to get as much into those 1,000 words as I possibly could. So it did take me much longer. In terms of the other times that I'd applied. Yeah, I found the situational judgment test. I had done it before, had passed before. So I just kind of used just examples that were online, but a lot of them were kind of, I used the medical examples. I think like a lot of the same themes run through it. So I was happy with that. But yeah, so obviously that was fine. But it is a very long, I mean, I'm sure we
Yeah.
found this. It does. In terms of my experience on it, the overarching thing is it is really long. And it's like, it is difficult at times to kind of I sort of keep motivated, but kind of stop obsessing over it because you can't sustain it for as long as it is. But it is really, really difficult. My interview experience was everyone on the panel was lovely. I don't know like what your experience obviously, but they were very welcoming. I mean, obviously I was so nervous. I mean, I couldn't have been more nervous going into it. I think the first few questions I was definitely had to calm myself down and things. But yeah, I think it was a really good experience. It's not, I'm someone that I don't love an interview. I don't know if there is people out there that come out of them and they're like, wow, I did amazing or anything like that, if there is. But yeah, I definitely came out of it, the interviewer did really well to get the most out of me, I'd say. I don't know about you, but I had quite a lot of follow-up questions, but I found those really helpful based on, they really were good in steering me towards what they wanted me to actually say, kind of thing.
Exactly. Yeah. I had a similar experience as well. So maybe when you try to answer the question wrongly, sometimes it asks follow-up questions and clarify better and give you an idea. They were really kind, honestly. And
Weren't they?
yeah, they were. Okay, so how did you prepare for your interview?
I did a lot of preparation. Especially coming from someone that I think if you maybe work in an NHS lab, you maybe wouldn't have to. But I was aware that because I hadn't worked in an NHS lab before, I thought I really need to understand this and really know it to a level to which I can adapt easily in an interview. I think in my head anyway, I couldn't have just memorized all the stuff I need to do. But if we look at it, so I think I don't know how it's split now, but our first part I think was general healthcare science, wasn't it? Our first kind of section. And then, you have more specifics and then it kind of goes on to NHS questions that you'd be expecting from, general things. For the general, I definitely struggled the most on the general bit. I don't know which part you found most difficult. I found it because there's like the specific ones for cancer genomics, you kind of vary. I went on the genomic test directory and just looked at what tests were offered, familiarised myself with it because I hadn't had any experience before with any of these techniques and stuff. So I really that was probably the main part of my revision as such, was around them, just to make sure I knew why and when they were used and things like that. So that felt I was happy with that because I kind of knew how to revise from it. I definitely looked in the curriculum. I don't know whether you I found the curriculum really helpful, just seeing what the trainee is expected to learn to kind of gauge, because obviously by no means are they expecting you to be able to list off things that you haven't learned them. But yeah, that was definitely really helpful to just know what they offer. For the general part that I definitely did, I found that element I struggled the most with. But looking back, if I was to give any advice, I would just be look at things that are common for all healthcare scientists. I was looking at the HCPC standard, just thought it was really helpful to just understand people, so just to understand what every healthcare scientist within the NHS is working to. And obviously, especially, I think it's quite difficult, I don't know if you find this, because with lab stuff, you're removed from the patient. It's so important to keep on almost zooming out and picturing where you are in the pathway and the ultimate effect on the patient. I think it's a bit easier when you're doing audiology or something where you're face to face with the patient and the intervention is done there and then. So I definitely made an effort to understand, okay, this patient would come in at this point, what would they have experienced before their sample comes to me and things like that. The last part of the questioning, I think there's lots of information on NHS interviews in general. Again, obviously goes without saying, really know your values.
Exactly.
Really, really know the values.
You can't avoid the values. Very important.
Yeah, they will get you in the end, the values. But I would definitely say as well, if I was going to give someone advice on the interview, things like values are such an easy thing to bring in earlier on. Don't bank on them asking you necessarily just an open question, a lovely open question at the end of, tell me all the values and everything you've done to show me all the values kind of thing. So I would definitely say they're very easy ones that when you're discussing the patient pathway at the beginning, you can very easily slot those values in just to reinforce to the interviewer, okay, this person understands.
Yeah, clearly that makes sense, because when you try to incorporate the values, it makes the interviewer see that you have an understanding of what the NHS is about and what you're expected to do in the lab as well. Okay, so about this specialty, how did you decide that cancer genomics was the best specialty for you?
I think from my undergrad, I did a lot of modules on cell signaling, which I loved. And then for my project, I did osteoporosis. So I did just different types of treatment for osteoporosis, and I looked at osteoclast and osteoblasts and things like that. And I really love just like how the body regulates all these systems, and just like, and then specifically in a situation where these systems become dysregulated, let's say. So after that, I obviously did my master's in cancer biology, which obviously would very easily lead me onto cancer genomics. Yeah, I would say I definitely kind of, I worked my way backwards because I did have, I don't know whether you had this in my biomedical degree. They did offer me genetics, but I didn't love it straight off the bat. It wasn't like, I kind of worked backwards, I'd say. Like, I liked the cellular signaling, enjoyed like, oh, what's this protein doing and things like that. And then during my like cancer biology, we went through lots of like targeted treatments like PARP inhibitors and things like that. And then I thought, oh well, that's really interesting, targeted treatments. And then I kind of worked my way back to, oh, the test they would do for that would be genetic testing. So yeah, but it definitely wasn't, in my undergrad, it didn't jump out at me, genetics straight off the bat. Yeah, so, but yeah, it's great now.
Yeah, so that means the decision majorly clicked during your master's that you
Yeah,
that this
definitely.
is what you love. Okay,
Especially with the targeted therapy and how you can actually
exactly,
help
exactly.
the patient. Yeah.
So that means you are really enjoying the master's module. We are currently doing a lot of regulation, signaling stuff, and those kind
Yeah.
of
I
biology.
mean, yeah, it's definitely very different. I don't know whether you found this, but one of the things I have struggled with is not doing something full time, because I've always only ever done my master's full time, obviously my undergrad full time. I think they're definitely doing this now. I definitely would say it's a better, you learn so rapidly on this course because you're doing it in work and because you've got the master's element. Like, yeah, it's amazing. But it's very, I don't know whether you find this, but it's difficult for me to know when enough is enough sometimes with the balancing of it, because especially with the university assignments, I'm used to just wanting to get the absolute best mark possible and spending the maximum amount of time I can, in which, yeah, it's definitely something I've learned to balance.
I completely relate with what you're talking about because it's not just about passing a master's degree. Now you are working and you need that information for work. So
Yeah.
at work, you are coming across a lot of new things and you are trying to read and learn. Then you have the university part as well, where you need to read, learn, and pass
Yeah.
the exams.
Yeah.
That part of the STP, I think I'm still getting used to it
Yeah,
because
definitely.
it's actually a lot. Okay, so you're training in Southampton. How did you want to go to Southampton, or how did you pick your location?
In all honesty, I kind of just went after, I'm from Cardiff and I almost just picked closest to furthest away. That was as far as my kind of, yeah, ranking went. I was happy to, like, I was lucky enough that I would have been able to go to like relocate far away if possible. Like, I would have been happy to do that. But yeah, landing in Southampton, I think it was I want to say my second or third choice. So
Okay. Okay.
yeah, very happy. It's not, yeah.
That's nice. So now that you're a trainee, so what are the things you do on daily basis? Because I know that being a trainee is completely different from being a clinical
Yeah.
scientist. So what is it like being a trainee? What's
Yeah.
your day-to-day activities in the trust like?
Yeah, so I'd say our weekly setup, I'm assuming I think everyone's is the same. So we have one day for university work. So that day I'm always at work from home on a Friday, and this I get through that. In terms of my work week, it can really vary, because if the majority of my time I've been on rotation, which obviously in first year you're fully aware that it is all about your observations. So it can really depend on what you're observing that day, to be honest. It can be anywhere from a whole day of observing a whole procedure, or it can be quite short bits, like broken up throughout the day. And when there are times where I have a bit of downtime or not observing it, obviously writing out my competencies.
Yeah.
And the main thing to try and really, that's definitely a learning I would suggest to anyone that is on the course or is, looking for the course, is definitely the best time to start writing notes on that is after you've just seen it.
Exactly.
When you do the first few, and you're kind of like, oh yeah, I can remember that. When it starts getting to you're observing a completely new technique on the Monday compared to the Thursday, it does get to the point where you're thinking, no, I can't quite remember.
Yeah.
So I'm hoping that obviously as we look at the curriculum, I think second and third year, I think it's natural to become more ingrained in service and things
Yeah.
like that, which I'm excited for. Yeah, but yeah, that's currently what it looks like.
Okay.
Yeah, getting on.
Let's talk about the specialty. So, for Cancer Genomics, can you tell us what Cancer Genomics is about and what you do in your specialty?
Yeah, okay. Well, I'd say essentially in cancer genomics, you're analysing tumour DNA to detect genetic alterations that could be playing a role in that person's cancer. And specifically as a clinical scientist, we do a lot of reporting, obviously, in cancer genomics. But on top of that, you'd be supporting validations, earning quality analysis. You can attend MDTs if you need to. And you're generally just, as a senior member of staff, when obviously you're qualified, you are just supporting the lab, supporting their turnaround times, and just helping make it as efficient as possible. We know that obviously genomics is a hugely expanding field. Turnaround times are falling down. So it's really just you're there as just support for that, and finding ways to make it as efficient as possible ultimately for the patient. In terms of the reporting, as we know, all different types of cancer, there are so many guidelines that goes with each one.
Yeah.
And your results specifically are used to classify patients. They can be used as prognostic indications, eligibility for targeted therapy. There's lots more targeted therapy on offer, to which a genomic is going to probably be the gold standard for a lot of it, even if it's not quite now. But it definitely, due to its sensitivity and things like that, is definitely the best way to understand if our patient's going to react to it. And then, obviously we do patients over a long time. We can detect minimal residual disease, so we can get an indication if they're going to potentially relapse and just how well they're dealing with treatments. So
Yeah.
do you think that's right? Obviously.
Yeah. I completely understand that. Then, most people tend to think that clinical scientists are into research, or I don't know. Most people always misinterpret the role of a clinical scientist. They always think it's about research or something. Generally, in the life of a patient. So, what role would you say a clinical scientist play in the patient pathway?
Within the patient pathway, I'd say you're definitely one of the main things as a clinical scientist is the equipment that you're responsible for. You're responsible that that equipment is trustworthy, so whether you're a vascular scientist or anything like that. You're definitely the overarching role, I would say, is you're testing the patient to kind of provide information that is relevant for them moving forward. So you're definitely supplementary to the consultants, and you're essentially providing them information from your area of expertise, whether that be, audiology, biochem, from your particular specific area of which you're expert in. You're giving them a report to which then because they know the patient, they know everything about the patient, they can just take all that information in and then decide on like a treatment pattern for the patient.
Yeah, yeah. Then, so for aspiring applicants, I know earlier you've talked about you've mentioned advice you have for aspiring applicants with respect to interview, but generally, if you have to give an advice, especially from considering how long the STP application process is, I don't know, how did you manage the pressure and the roller coaster of feelings and emotion that comes with waiting? I find the waiting period stressful. So how did you manage the stress of waiting for the STP outcome, the results, and all that?
Well, I think it is very difficult. I'm kind of have mixed feelings on it because I don't know whether with the student room, were you on the student room?
No, I was on Discord.
No. Discord, yeah. So what I would say is they're so valuable for information. If you've got any questions, they're amazing. My major thing would be really try and not compare yourself to the discussions that are going on there. Everyone, within our cohort, some people have come straight from undergrad, some people have PhDs. I just think they can really try and focus on, it's a major part of the training program is self-reflection. So I'd really, really make sure someone would just try and do that in the application process and just kind of bring it back to yourself. You're a good candidate. You'll be a good candidate. I just think understanding your strengths and weaknesses and really just don't compare to others, because I think it is disheartening as well. Because the process is so long. I think half of it you don't really understand how they're marking it or what they're doing. So I think it's just best it's really difficult to try and do, but just to not overthink it. which I understand is very, very difficult. But yeah, so I kind of had to go off the student room and Discord at points where I thought I'm getting too, people were trying to figure out certain things and I was getting a bit too stressed with it. But I definitely just brought it back to myself and just, I would say that don't get hung up on comparing yourself to other people's experiences. Just remember what you can take away from your own personal experience. That's kind of the summary of it.
Yeah,
That's what I definitely say.
that really makes sense because
Yeah.
while I was on Discord, sometimes I found it helpful. You know, when they had to change a lot of things like our ranking and our process.
Because it was difficult to understand, wasn't it? Yeah.
Exactly. And also during our short, so many things changed and it was so stressful. And they announced it late that our interview was going to be competitive. So I was
Yeah.
stressing out, and being on Discord, getting all those information was really helpful for me. So yeah, just like you said, I found those platforms helpful for
Yeah.
information. But when it gets to
Definitely.
the point of other people talking about themselves and all that, I try not to compare myself, and I try to take it all in and just wait.
Yeah.
There's nothing much you can do. It's just wait.
Yeah. Yeah. I really do sympathise though, because I mean, what is it from January to, I think,
Thereabout.
yeah. I mean, most jobs, that is a long,
Yeah,
long wait.
that's
Yeah.
right.
So I really, really do sympathise. But yeah, I would just say, like I said with the interview before, just really know it to how well you can know it.
Mm.
It does need preparation. I don't know how much you prepared for your interview, but it needs.
I really prepared for the interview because I found that helpful. If I wasn't preparing, I felt like I was doing nothing. So I found doing
Yeah.
something.
So that is where I
Help.
would say that the gap is useful
Yeah.
in terms of just fill it with just try and immerse yourself as much as possible. I remember I started following just genetics accounts just to see if there's anything, because you just never know where, you don't know what questions you're going to get, and you just don't know where your brain's going to go kind of in that interview. And something could have popped up on your phone from somewhere you followed and you break through a swing, which will be helpful for you to do. But yeah.
Yeah. Okay, then you mentioned this being your you getting into the STP on your third trial. So what did you really do to improve your application? So you said you wouldn't count the first one. So from your
Yeah.
second application, what stage did you get to, and how did you improve your application for this third one that you tried?
So I think the second application I got through to long listing. I think, yeah. Yes, I wasn't shortlisted. So the first one, the reason why I say I don't count that is I essentially didn't look at the core specification, and I kind of wrote it as more of a I love genomics kind of pitch, was kind of what I wrote. Like it was more of a story, it was more of a, and I think it read lovely. I mean, it was a nice read, but I think that, yeah, definitely from that to the third one, in my mind, I think the majority of NHS like interviews, this is how they would kind of mark you anyway. But I basically just, in the application process especially, I just wanted to leave no doubt that I'd filled that criteria, which I don't know how, how you went about writing yours, but sometimes you're thinking, oh, it doesn't sound as nice. But really and truly, that if we think about that person who will be marking, they are going to be marking a huge amount. They're going to be comparing it to the course specification. I think they just, in my mind, I thought if I was marking this, I'd want to really clearly see, okay, this person is a good communicator, tick. This person is this, and this. And that definitely is what helped me from the first application to the third. Just give no doubt that you have filled this point.
Yeah, I
Yeah,
see.
which is definitely very helpful.
That makes sense. So yeah, the
Yeah.
corporate things, but it's always one of my number one advice to anyone applying to the SCP. It's always about the core person specification rather than writing any other thing about yourself. Okay, that's really nice. So what's your favorite part of the training right now, or should I say your favorite part of the job?
Yeah. Um, like I touched on earlier, I'm so thankful for how quick you can learn stuff in how the STP is set up. So although it is intensive, the payoff, I don't know if you found this, it definitely comes from even week to week, you're learning such a rapid pace because you've got that university element to back it up. And then on the place working is amazing. I think like I said earlier, one thing I love about genomics is just how much it's expanding. And like even when we look at like guidelines and things like that, it's becoming a lot more, as it's become a lot easier to sequence. Obviously, the reward of that is obviously that it's kind of being introduced into a lot more of the cancer guidelines, things like that, which I think is really exciting, especially in terms of future treatments. Yeah, just yeah, for my main thing about the job, just so exciting.
Yeah, it's really exciting, and I mostly the part of the STP I mostly appreciate, especially the structure, is in bioinformatics. You remember how we all struggled with the university module.
Yeah.
And getting used to it. So having to learn it in university and just dealt with all the struggle there. Then coming to the bioinformatics rotation, it's all started to make sense, and I didn't have to struggle that much. So it's actually very exciting, and the
I think
structure is perfect.
yeah, and I think I don't know about you, like when you speak to other people on the course, it is I was very nervous because I hadn't had NHS like lab experience. And I was thinking, oh, I'm going to be at such a disadvantage when I start. But it's really nice how the program is structured. I think that I think we're all like level. It is really nice that you can just go into your like teaching week, you can speak to everyone, and it is just you're all getting the same experience. Which is really really helpful for me, especially something because I was stressing. But yeah, it's been great.
If you have one advice to give to anyone out there coming into the STP, what advice would you give to that person?
Wow, I would definitely say when you first start, use all the resources that are available. I definitely would say right from the beginning, sign up to monthly memos, sign up to, and really talk. Very, very useful to talk to the other STPs that are in the few years above you. Like the tips they give were just invaluable. And yeah, I would just say enjoy it. You've worked. You've worked. I mean, it's such a long process.
Yeah.
That really just immerse yourself in it. But yeah, feel free to just. I would just say ask all the questions to anyone anytime, just to get. Yeah, I would definitely say that just to.
Okay, that's very nice. Thank you so much, Sophia. It's been absolutely wonderful speaking to you today. And thank you for all the advice and all the tips and taking us through Cancer
Thanks
Genomics.
for having me.
All right, thank you so much. And we'll see in May for our exams.
Yeah, May. Yeah. Good luck revising.
All right, thank you very much. Good luck to you
All right.
too.